Hello and welcome. So glad that you are here with us today. Thank you for joining us for today's webinar, Uncovering America's Best Kept Secret, Family Resource Centers and Family Resource Center Networks. I am Julie Matusik, and I am joined by my colleague, Mary Robinson Griffey. Mary, want to say hi?
Hi, everyone.
Mary will be co-presenting with me today. We will be your team, excited to share this wonderful information with you. So some housekeeping items real quick before we dive in. Let's see here. So if you are joining us online, you may listen directly through your computer speakers. And if you have joined via the phone number that Zoom provided, your line has been muted to minimize background noise. And for those of you that are online, you can find a link that will be in the chat in just a few moments here that will take you to a Dropbox folder that has some handouts in it that we'll be referencing throughout the webinar today. And we also invite you to put any questions that you may have into the Q&A section at any time. We do also have the chat section open for any comments that you may have throughout the webinar. Certainly invite you to engage there throughout the webinar. But we do ask that you put all of your questions that you may have right into that Q&A section of Zoom so we make sure that we don't miss those. If you are having any tech issues at all, we do have live tech support here today. We have Cheryl and Katie here as our tech team, and they are happy to help you. So you can just let them know in the chat and they will be able to support you. So speaking of questions, as you are entering those into the Q&A, we will be taking questions at the end, and we will do our best to get to all of those questions at the end of the webinar. If we happen to run out of time, someone from the National Network will follow up with you after the webinar. And last thing we want to mention is that today's PowerPoint, as well as the handouts and a recording of the webinar, will be available on the NFSN website on the webinar Wednesday page by this time tomorrow afternoon. So you'll be able to share this with anyone that you would like. And last brief thing to mention is that when you exit the webinar today, an evaluation will pop up on your screen. It will automatically appear. You won't have to do anything. And we do ask that you take a moment to complete this, as it very much helps to provide us with valuable feedback to inform future webinars. So thank you in advance for taking a few moments to complete that feedback evaluation. All right, so we are excited to get an idea of who is here today. You'll see we've divided the United States into regions. And so take a moment to see which corner of the United States you're in. If you're from outside of the States, we also have some international options as well. So we'll launch the poll here to get a sense of where everyone is joining us from. So let us know where you are joining us from here in the poll. We'll give you about 5 more seconds. If you haven't had a moment to respond yet, let us know which corner of the United States you're in, or if you're from Canada, or if you're from another country. And thanks to you all that are sharing a bit about you in the chat. It's lovely to learn a bit about who's here today. Sounds like we have great representation. That's so exciting. All right, let's see those results from the poll. Wonderful. All right, West wins today. strongest representation from the West Coast. However, we do have representation from the Midwest, the South, and the Northeast. So very cool. Thank you all so much for responding to that poll. Great geographic diversity here today. Wonderful. All right, so thank you so much for responding to that poll. Another quick question that we'd like to ask, which is about your affiliation. So one other poll here. So take a moment to let us know a little bit about yourself. So maybe you work for a family resource center or a family resource center network, or another type of family support program, or maybe you're a parent leader or in early care and education, or more broadly education, government, child welfare. We have another government category there. Maybe you're a private funder. And if you put other, feel free to let us know in the chat what you're up to. And thanks again for everybody letting us know in the chat. Wonderful, wonderful. All right, take just another moment here to let us know your affiliation with this poll, and then we'll close this out. Excited to see our results. All righty, let's see those results. Great. Great diversity here in affiliation as well. 37% of folks are from family resource centers. We have other family support programs, parent leaders, early care and education, government, child welfare, private funders, other. Great diversity here as well. That is wonderful. Great. Well, thank you all so much for sharing a little bit about yourself. That is wonderful context for knowing who's here today to inform our conversation. All right, so here is a brief peek at what we'll be covering today. So we won't be together too long, but lots to cover. And so we'll be talking about family resource centers, and then we'll be looking a level up at family resource center networks. And then we'll share some information with you about the National Family Support Network. And then we'll share some resources and opportunities with you that are available from the National Family Support Network. And with that, I am going to pass the baton to share some history from Mary.
All right. Thank you so much, Julie. So we're going to get started here with a little historical perspective. The concept of family support dates back to the late 1800s with the creation of settlement houses in major metropolitan areas, such as New York, Boston, Chicago, and San Francisco. Settlement houses provided the large number of immigrants who were entering the country at that time with support, job training, English classes, and social advocacy. And this was as a means to assist them in understanding, adapting to, and succeeding in American society. This slide here illustrates the Good Samaritan Settlement House in San Francisco. On the left, you see it as it looked in 1913, and on the right is its modern look as the Good Samaritan Family Resource Center, and it continues to serve families today. Originally, it was serving immigrants from Europe. Good Samaritan now has evolved with the changing community needs and shifts in the neighborhood population, and it is now a family resource center serving the Latinx community. Thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as America's best kept secret. A family resource center is a community or a school-based welcoming hub of support, services, and opportunities that are designed to support families to be strong and successful. They may be community-based, like the image you see here on the left of a family resource center in Vermont, or they may be school-based, like the image you see on the right from the state of Kentucky. They may also be in rural settings, like the image you see on the left from Colorado, or in urban settings, like the image on the right of a family resource center in the Bronx, New York. Wherever they're based, family resource centers work with families with an approach that is not only two-generational, but multi-generational, strengths-based, and family-centered. And each of these concepts is equally important. So let's talk about them. So have you heard of two-generational or two-gen work? Well, family support is the original, not just two-gen, but multi-gen work, as the programs work with children, parents, and grandparents as well. They are also strength-based because we see families as having strengths that we want to support them to build upon. And finally, they're family-centered because everything we do has families at the center. They're also designed for all families and not only low income or highly challenged ones. So the support they provide is non-stigmatized, making it more readily accessible. Programming is provided at no cost or low cost for participants. And the image that you see here on the right is of a family success center in New Jersey, where there are 57 centers across the state's 21 counties. Each county has at least one, and typically more than one family success center. And that includes highly affluent counties as well as highly challenged counties, because again, the belief is that all families can benefit from access to support for two of the most important roles that we can have as adults, being parents and being spouses or partners. These are two of the most important roles that we can have, and for which we typically do not receive any support or training. Hence, the value of universal access to FRCs. So as we're talking about family resource centers, it's very important to talk about the Strengthening Family Protective Factors framework as part of our foundation. So let's launch a poll to see how many of you are familiar with this framework before today. Okay, and I'll give you a few more minutes to finish voting in this poll. We really appreciate you participating. Okay, let's see those results. All right, so we've got individuals here from every part of the scope. We have some that are not familiar to some that are very familiar, with our strongest representation being somewhat familiar. So that's very interesting to know. Thank you all so much for participating in that poll for us. So the Strengthening Family Protective Factors framework comes to us from the Center for the Study of Social Policy. Research has shown us that these 5 protective factors increase family stability, it enhances child development, and it reduces the likelihood of child abuse and neglect. So as we're working with families, we want to support them to build these protective factors because we know that they make a positive difference in their lives. The protective factors themselves are listed here, and we encourage you to visit the Center for the Study of Social Policy website, where you can learn more about them. They have a whole Strengthening Families page with a lot of information that you can dive into on this key framework. So with FRCs, there are a couple of things to mention that are very important. And the first one is there's no dedicated federal funding for FRCs, like there is for other programs such as Head Start, home visiting, or after-school programs. And yet, there are now more than 3,000 nationwide, and they are working with more than 2 million people annually. So why are so many public and private funders at the state, county, city, and community levels choosing to invest in FRCs? Well, simply put, FRCs are just a good idea. They're cost effective. They're highly adaptable for various communities, whether they be urban, rural, or ethnic, and they've demonstrated successful outcomes through multiple external evaluations. As conveniently located hubs, They bundle and co-locate many services that may be familiar to you already, such as home visiting, evidence-based parenting education, health screenings, play groups, fatherhood programs, family counseling, and food banks. FRCs are unique because they are by, of, and for the community. Families themselves are engaged in shaping the programs and services to be responsive to their interests and their needs. Staff are hired that are representative and have shared lived experiences of the different layers of diversity that the Family Resource Center is serving. And there's also parent advisory committees, which impact program development and implementation. And as we often say, if you've seen one FRC, well, you've seen one FRC, because they're all so unique and they cater to their own communities. At the same time, despite their organic development, there is remarkable similarity in their most common service areas. This data comes from a national study funded by the Robert Wood Johnson Foundation that the National Network worked with a research institute to conduct. You can see outlined the most common service areas for a family resource center. First, there's parenting support, and this exists on a continuum from lighter touch on the left to more intensive services on the right. So with lighter touch, you're going to see things like parent workshops, and then moving along the continuum, we start to see parenting support groups. And then we move on to parent education series where we're using evidence-based curriculum. And then finally, that most intensive would be home visiting, where programs are actually going into the parents' homes. The next common service area that we see is access to resources. And this also exists on a continuum from lighter touch to more intensive services. Here we start with enhanced information and referral. We move on to concrete supports, and that's where that Family Resource Center is actually providing resources. They're providing things like clothing, food, and rental assistance to families. Then we see where we're working with families over time to address family identified goals. And finally, there's co-location of those resources. And this is the most intensive way that the Family Resource Centers are providing access to resources, because it becomes a one-stop shop where families may access resources like WIC or a food pantry, and it's all under one roof. The other most common service areas that you see on the slide are child development activities and parent leadership development. And Family Resource Centers not only provide programs, but they also build communities of peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse. But just don't believe me. Let's hear from Sheila, a parent in Corning, New York, and what she has to say about the value of Family Resource Centers.
People underestimate how challenging it can be of trying to balance parenting and effective parenting, mind you, and not having a space to actually vent and communicate and learn alternate ways of rearing their children. People don't realize it is a support that they need, not once in a while, but like all the time. I could see the excitement, the smiles. It is the same every single time they walk in the door. The staff is so friendly, the space is so inviting. So it gives us an opportunity to just like kind of brush off life and then escape into this space where they could just relax. And it nourishes us, it feeds us, and allows us to just make, take all of that and positive energy and do life. Regardless of anyone's socioeconomic status, regardless of racial background, educational level, the need is exactly the same. It is a place, a need for a place to be able to sit down with other parents and do life together. And that is something that is so impactful. Once they have that support system in place, it has a ripple effect. And we will glean from that because our communities will thrive. The more support, I mean, it's just, it's like a domino effect.
It's so validating to hear what Sheila has to say as a former Family Resource Center coordinator myself. And hearing about her experience with Family Resource Centers and to know that life-changing impact that FRCs have. And it's just like she said in the video, and it gives me cold chills every time. We are doing life together. So now that we've talked a little bit about Family Resource Centers, I'm going to launch another poll to ask if you've seen programs that look like Family Resource Centers in your state. So to your knowledge, does your state have programs that look like Family Resource Centers? I'll give you just a few more minutes to finish voting in this poll. All right, great. Let's see those results. Wow, that's an overwhelming yes, with 72% saying that you have Family Resource Centers in your state. That is so exciting, or programs that look like Family Resource Centers. So that's so exciting. Just a few of you on the know, and then some that are not sure. So we'll continue to go through the information, and maybe you'll have a better idea of whether or not those exist in your state. But thank you so much for participating in that poll. So an important part of Family Resource Center's story is that their response to the recent COVID pandemic. Over the past couple of years, the two things families have most been seeking support for during the pandemic were parenting support and access to resources. And those just happen to be the bread and butter services of any Family Resource Center, whether they be urban, rural, school-based, or community-based. So FRCs more than rolled up their sleeves to help support families through the crisis. The photos on this slide illustrate some examples, such as a drive-by shows of support for families in Kentucky on the upper left. We see some infant supply distribution in Colorado on the upper right. Then there's a virtual bilingual story time in Massachusetts, lower left. And then finally, we see in Kentucky where the school-based FRCs took on delivery of free lunches to students while the students were not able to go to school because they were closed. So as a result, there's been a lot of opportunity to highlight the valuable work that Family Resource Centers have done. And because of FRC's strong response to support families through COVID, they're emerging from under the radar in both red and blue states across the country, and they are committing new funds to support them. The next couple of slides that I'm going to be sharing highlight the funding that states have invested in Family Resource Centers. Fortunately, we're needing to update these slides on a regular basis. I'm just going to give you a couple of minutes to read through these. So it's very exciting to see this funding going into line items and budgets. Here are a couple more from Kentucky, Maryland, Nevada, and New York, with the funding to specifically open new FRCs for specific populations. And as you can see with the expansion in New York, they're going from 3 to 30 centers. Here are some more from Texas, Utah, Vermont, and Washington. And finally, we see a couple from West Virginia and Wisconsin. And again, all of these states have chosen to invest in Family Resource Centers. And I just want to mention as a reminder that these slides will be available on the National Family Support Network website. So you'll be able to dive into these further. and look at them as we continue to update them with new information. So this slide, which was developed in partnership with Casey Family Programs, is one of the National Family Support Networks, who is one of the National Family Support Network's national partners. And it illustrates how Family Resource Centers work with families across the continuum of potential involvement in the child welfare system. Now, we do realize that the text on this slide is a little bit small. However, you can download a copy of this from the National Network website by going to nationalfamilysupportnetwork.org. And there you'll want to hover over family support and then drop down to Family Resource Centers, where you'll be able to see how FRCs are working with child welfare departments across the country, ranging from primary prevention to differential response, open child welfare cases, and post-reunification. So now I've got a couple of really exciting statistics that I'd like to share with you about the value of Family Resource Centers. This one comes out of the state of Alabama, and it tells us that for every dollar invested in Family Resource Centers, the state of Alabama receives $4.93 in immediate and long-term consequential financial benefits. A University of Chicago study found that neighborhoods with Family Resource Centers had 26% lower rates of child abuse and neglect investigations than similar neighborhoods without them. In Teller County, Colorado, which is a semi-rural county outside of Colorado Springs, since their Human Services Agency moved to a differential response system in 2016. And what that means is they're referring screened out families to participate in Family Resource Center services on a voluntary basis. Well, since they've been doing that, they've seen a 63% drop in their child abuse rate. And they only have one Family Resource Center in the whole county. Think of not only the huge cost savings, but the human cost savings. So many families that are now spared entry into a highly traumatizing system that no family wants to have anything to do with. And once you're in, well, you may never get out. This latest data, it comes from research studies supported by Casey Family Programs, and it illustrates the specific child welfare system cost savings, both in semi-rural Teller County and in urban Orange County, California. This data comes from the state of Colorado, where you can see that families that are participating in Family Resource Centers are demonstrating statistically significant improvements in economic self-sufficiency, health, concrete support in times of need, social support, family functioning and resiliency, caregiver child nurturing, and attachment. And Kentucky has 856 Family Resource Centers, and all of them are school-based. It is the second largest network in the country, and they have seen results. They've seen incredible improvement in children's educational success and attainment since developing FRCs 30 years ago as part of their statewide education reform legislation that took place. And they've moved significantly on the chart from 45th place in the 1990s to being in the top 15 school systems in the country. Now, all of these statistics can be found on that family resource page at the nationalfamilysupportnetwork.org, where you'll hover over family support, drop down to that Family Resource Centers page, and you will be able to see all of this information there. So after seeing the data on impact, you might be asking yourself, well, how much does it cost to run an FRC? And well, it varies in relation to local cost of living, specific programming that the center is going to offer, and the physical space. And we're going to provide you with a couple of examples here. So the first one is a typical community-based New Jersey Success Center, which has an annual budget of $240,000 to $300,000 and 3 to 4 full-time staff. Next, we see an example of a school-based FRC in Kentucky, and there they have annual budgets anywhere from $33,000 to $82,000, and they also have 1 to 2 full-time staff. Here, it's interesting to note that the space and the other resources are provided in kind. So another common question that we get is, how are family resource centers funded? And the majority of them are funded through state, county, and municipal governments, while others might leverage federal funding, such as community-based child abuse prevention or CDCAP funds. And another way that FRCs are funded is through foundations, corporations, individual donors, and in-kind support. Another thing to mention is that some have chosen to leverage FRCs to provide up to 12 months of in-home parent skill-based programs for parents or relatives caring for children who are candidates for foster care. So I want to note that this is specific to that family first funding. And when we're talking about in-home, we're not saying that the services are necessarily taking place in the home, but rather that the child has not been removed from their family. Family resource centers are providing programs from the Title IV-E prevention services on the clearinghouse. So they're able to provide different programs such as Incredible Years, Healthy Families, Motivational Interviewing, Parents as Teachers, and Triple P. And they do this so that they are able to leverage that family first funding. So family resource centers can also be leveraged to implement kinship navigator programs, and networks of FRCs can support successful planning and implementation of Family First. And New Hampshire was the very first state network to do this. And now I'm going to turn things back over to Julie, who's going to walk us through Family Resource Center networks.
All right. Thanks, Mary. So Mary did a great job walking us through all things family resource centers. And so now we're going to look at one layer up at how those family resource centers are coordinated. So how those are connected. So not only have these cities and counties and states hit upon the value of family resource centers, but they have also hit on the value of networking them together as well. So Family Resource Center networks, they consist of 2 or more family resource centers that have decided to come together and form a network. So these networks ensure coordinated quality support for families. They serve as the backbone entity to leverage and to coordinate the collective impact of their members. And they may be an independent nonprofit, they may be coordinated by a public or private funder, or they may be led by a family resource center directors themselves that are serving as a volunteer leadership capacity. And so, similar to how Mary talked about the most common functions of family resource centers, from that same project, the Omni Institute, we also looked at the most common functions of family resource center networks. So, the most common functions of Family Resource Center networks are that they increase the connectedness, the coordination, the cooperation, and the collaboration amongst their members. They provide training and technical assistance. They work on advocacy, policy, and legislation. And they provide and maintain a shared data tracking system. So those are the most common functions that we see. Not all of them do all of those things, but those are the most common. And then when we're looking, when we're talking about networks and looking at them, we talk about them and look at them in at 2 different ways. So the first is the stages of network development. And so when a network is first starting out, they are considered an emerging network. And so that's typically those birth to 3 years when they're just getting started. They are determining who will be at the table, what they want to focus on, things like that. And then in that 3 to 5 year mark, typically, they are considered evolving networks. And so as they are further developing, these networks may hire a contractor, they may hire their first staff. The network is beginning to have more structure and the capacity to do more. And then established networks usually have been around for at least 5 years or more. And these networks typically have staffing and they have a track record of activities. And one interesting characteristic to share here of these networks is that they have weathered crises together and that they have decided to stick together. And one other way that we talk about networks is the type of network that they are. And so and this is how they're coordinated. So the first type of network is a volunteer coordinated network. So these networks are led by family resource centers. And so family resource center directors, I should say. And so this is done in a volunteer capacity. And these family resource center directors are doing this on top of their regular, the work that they're doing already at the family resource centers, and they do not have paid network staff. So New Hampshire is an example of this. And then funder coordinated networks are another type of network. And so they are led by a public department or a foundation that both funds and convenes the centers. And so Nevada is an example of this. And then we have independent networks. So independent networks are a staffed, independent nonprofit organization that functions as a membership alliance with members that pay dues. And so these networks, they may raise or they may distribute funds. So they may function as an intermediary or they may not. So Colorado and Maryland are two examples of this. So these are just a couple ways that we look at Family Resource Center networks and talk about them. All right, so looking one layer up, we'll share briefly about the National Family Support Network. And so the National Family Support Network was co-founded by the 8 states that are green on this map. And so for the first 4 years of our existence, the NFSN had no paid staff, and the steering committee members coordinated the work of the National Family Support Network as volunteers on top of their jobs running their state network. So volunteer coordinated for the first 4 years. And here you can see what our current membership looks like. And so over the last decade, the national network has quadrupled in size and now have 38 member networks. So 37 states and the District of Columbia. And so this represents more than 3,000 family resource centers that are serving more than 2 million people annually. So pretty incredible. Minnesota is our newest member, and really incredible to see this map changing and updating regularly. Here you'll see our mission and our vision. Our mission is to promote the positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource centers, networks, and championing quality family support and strengthening practices and policies. And our vision, in short, is that that map that you just saw, that whole map would be green, ensuring that all families across the country have access to quality family support services in their very own communities that are supported by quality family resource centers that are supported by strong networks. So here you can see our areas of work. And so we divide the NFSN areas of work into 3 buckets. And the first is connecting and convening our member networks to enhance their effectiveness. So increasing the connectedness amongst members for peer learning and for mutual support. And the second is promoting family support best practice and evaluation. So raising awareness of what quality family support is and promoting a common language and standards and evaluation of it through the national implementation of the standards of quality for family strengthening and support. And our third area of work is raising the visibility of the value and the impact of family resource centers and family resource center networks in order to strengthen and increase support for families. So those are our buckets of work. And here you can see what membership with the NFSN looks like. And in order to be a member of the national network, it's at least 2 or more family resource centers coming together to create a network, and you can be at any stage at all. And there's just one network per state. And so dues are intentionally kept very modest and affordable to make sure that it's accessible and not a barrier to newer networks coming aboard. And so speaking of quality practice, want to share about the standards of quality. And these standards, the standards of quality for family strengthening and support, are designed to be used by all stakeholders. So public departments, foundations, community-based organizations, and families as a tool for planning, providing, and assessing quality practice. And so these standards, they uniquely integrate and operationalize 2 key frameworks from our fields. So the principles of family support and the strengthening families approach, and their research-based and evidence-informed 5 protective factors, which you may be familiar with. And these standards are incredibly important to our field as you're thinking about family resource centers and family resource center networks. They create a common language across different types of family strengthening and family support programs. So whether you are in a family resource center or a home visiting program or a child development program, you're able to speak the same language. And they help ensure that families are supported and strengthened through quality practice. And these standards, important to underscore here that we are not selling them. They are available for free, as well as all of their implementation tools on the NFSN website. So you can download them at any time. We want to make sure that anyone is able to do quality work with families and is able to access the standards themselves as well as the tools. So encourage you to download those on the National Network website at any time. And I also want to briefly share too that these standards were reviewed and revised in 2020 and then approved by our membership in March of 21 to reflect a enhanced focus on diversity, equity, and inclusion for relevance for both the Canadian and United States context. And you can see here the 5 core areas of practice. And you can see just at first glance how key all of these are to our field, right? So family centeredness, family strengthening, diversity, equity, and inclusion, community strengthening, and evaluation. And this is a map you can see just kind of where the standards have been over the past decade. And so the standards trainings you can see have taken place in states that are not members of the national network. Anyone can use the standards. It does not do not need to be a member of the national network to use the standards at all. But you can see over 14,000 people have been trained on the standards over the past decade. And just incredible to see how far the standards have gone. Um, so this map gets updated monthly, and it's just so exciting to see the growth. And speaking of supporting and strengthening our nation's families, we want to share this project. This is a project that the National Network worked with our members on to develop a blueprint for how to scale family resource centers and family resource center networks to ensure that all families have access to quality family support and strengthening services. So this is a document where we are publicly, we're regularly updating it and we're publicly reporting back on it each year at our briefing event that takes place in May. So uh, be sure to watch for registration for that to open, which will be a virtual event and is free. So be sure to check that out. So since the beginning, when the idea of starting the national network first emerged, the co-founders reached out to these organizations to offer their supports. And so you can see some of the national partners that are part of that are regularly presenting with the national network. So they're co-sponsoring and collaborating with us. And we also want to share some resources that are available to you through the national network and want to highlight some things. We know there's so much on the website and just want to point out a few areas um, where you can find some very key things that we think will be helpful after today's conversation. So the first is the Family Resource Center page. So if you go to nationalfamilysupportnetwork.org and then click on family supports and then drop down to family resource centers, you'll see tons of information. There's family resource center overviews, there's videos, there's virtual tours of family resource centers. There's tons of funding information. A lot of the information that Mary covered is actually right on there. Some of those funding, the funding reports and things like that. There's even more than what was covered today. There's Family Resource Center overviews where you can find some of the summary information there as well. So encourage you to check that page out. We think you might find that very helpful. Also, the Webinar Wednesday page, we think you might find very helpful as well. So if you go to nationalfamilysupportnetwork.org and then click on Webinar Wednesdays over towards the right, you'll be able to see all of our upcoming Webinar Wednesdays, and you'll also be able to see all of the archives. You'll see the library. So there's ones particularly related to family resource centers, family resource center networks, and just tons of other, I think there's 5 pages total that you can scroll and see where we've highlighted different networks and different centers. There's a page dedicated to the standards as well. So encourage you to check that out as well. One other resource that we're excited to share with you that just launched this year, this is the Family Resource Center Learning Hub. And this hub is designed to provide tools and sample materials for those of you that are seeking to develop individual family resource centers. So rather than reinventing the wheel, we want you to be able to work smarter, not harder. This is organized into 6 phases of development. And the phases that we thought that seemed logical as you're developing a new family resource center. And so it's broken down, there's accompanying resources for each of those 6 phases. And so this hub is completely free. So there's some tools. There's tools that, there's some samples that come from centers across the country that are actual, maybe some sample job descriptions, for example. And then there's some templates that we have actually designed that we think might be helpful for you as well. So encourage you to check that out. And so, like I said, it's free and encourage you to access that. And let's see here. Okay, another resource that we want to share with you too is the member network snapshot. So this is a resource that we update annually, and this is probably more for folks that are here today at the network level. And if you're wanting to learn more about Family Resource Center networks, this would be where we would suggest you go to take a peek. So if you go on the website to so nationalfamilysupportnetwork.org and then go to the network page, and then you'll be able to, or I'm sorry, about us, and go to membership, you'll be able to see a membership map. And so you'll be able to click on Alabama, for example, and this will come up. You'll be able to see their individual snapshot. And right above the map, you'll be able to see where you can click on the to download a collective of all of the snapshots for all of our members. So let us know if you have any difficulty accessing that, but we hope that will be a valuable resource for you as well. And similar to the Family Resource Center Learning Hub, we have a network hub for resources for networks. So this is a compilation of both NFSN templates and documents from member networks that can be used as examples for Family Resource Center networks and funders of Family Resource Centers. So this has two sections. And so the first section is network tools for Family Resource Centers. So these are samples of tools that networks would use with Family Resource Centers. So such as Family Resource Center identification surveys, Family Resource Center evaluation frameworks, requests for proposals, FRC proposal review tools, things like that. And then the second bucket is network tools for networks. So these are samples of tools that networks would use to run a network. So these are things like membership agreements and network development continua and network job descriptions and network operating guidelines, things like that. So again, this is completely free to access and is accessible on the network page on the website. Okay, so that is the network hub. And in addition to all of the nooks and crannies on the website, I just want to put out there some of the services that we offer as well. We are able to facilitate connections to NFSN member networks, and we are able to present to key stakeholders and educational, so such as educational leaders, child welfare leaders, children's trust funds, and other public and private funders about working with and investing in family resource centers. We also are available for technical assistance for Family Resource Center network development and other TA projects as well. Our technical assistance calendar is filling up for 2023. So if this is something you're interested in, definitely let us know sooner rather than later. We also have trainings available. So both the standard certification training as well as the developing and sustaining effective parent advisory committee training. All right, we want to pause for just a second to just give you a moment to think about any questions that you may have, and what resonates with you from the information shared. Feel free to put that in the chat, and what you would be interested in exploring more. And if you have any questions, put those right into the Q&A section. If you have any questions that you would like answered, please direct those to the Q&A sections. If you have just any comments or things like that, feel free to put those in the chat. And let's see, so slides will be available. They'll be posted to the website tomorrow afternoon with the recording. And while you're just reflecting on everything that was shared, I'm just going to share a couple of things while you're thinking and entering those questions, and then we'll make sure we have time for questions before we close today. We definitely have time. So want to share the upcoming webinar Wednesdays. And so next week we have, I think next week, right? Yes. Next week we have the sharing the caring family resource centers and healthcare partnerships. Really excited for this. If you know anybody that's in healthcare, this is a wonderful opportunity to leverage family resource centers. So definitely share this webinar with them. And we also have the following week coming up, the Network Spotlight webinar, where we'll be spotlighting the Utah Network. And then well, first week in April, we'll be having an overview of the standards of quality for family strengthening and support. And of course, we have a library of webinars on the website as well. And I see there's some discussion comments around parent advisory committee. So perfect timing here. The Developing and Sustaining Effective Parent Advisory Committee training we offer throughout the year. And this is a virtual training, and it's a unique and highly rated training for program staff to maximize the great potential of parents and these parent advisory committees. It's co-trained by a NFSN staff team member and a national parent leader. So encourage you to check this out. There are still some openings, I believe. So encourage you to get registered for that if you are interested. And it is currently only offered in English. And if you go to the website and nationalfamilysupportnetwork.org and then click on the training page, it's also right on the home page as well. And maybe one of my colleagues could drop the link in there for that. And I can in just a few moments as well. So that's that. And then we also have the standard certification page. Like we said, the standards, we aren't selling them at all. You can download them at any time, as well as the implementation tools. That being said, the certification training is a wonderful opportunity to go deeper with them, to learn more, and to really apply them to your work. It's also an opportunity to have a professional credential that you'll have that goes with you regardless of where you may work in the future. So this is training. We have openings still for the March. We have a couple openings there, and for the April as well. So thanks, Cheryl, for dropping that link in the chat for the NFSN website. And it's right on the homepage, links for both of those. All right. So here is our contact information, and let's open the question box here. Taking these questions, and feel free to still be answering questions. We still have time. Just make sure you enter them into the Q&A section so we have all those captured in one place. I just want to make sure I don't miss any. So one question we have is there a specific criteria that needs to be met in order to be considered a family resource center? And so the short answer is yes-ish. Family resource centers, they all look different because all family resource centers are designed to serve their specific communities. And so they all look different. However, they all do have certain things in common. So thinking back to some of the slides that Mary shared, so they're all multi-generational, they're all strength-based, they're all family-centered, they're all designed for all families. So they're not exclusive to, for low-income families. They're not just for certain families. They're all no or low cost. And they all are strength-based and support families to build the protective factors. And they're all place based, so they're not virtual. So that's some of the criteria. And if you go to that Family Resource Center page, you'll be able to see some of that information kind of all in one place. I hope that answers your question, Olivia. Feel free to follow up if you have more questions there. And I see there's a question about typical funding sources. And I know we had the slide about funding that talked about some of this. And we had talked about how there's state funding county funding, municipal funding. Some are leveraging Families First funding, CBCAP, foundations, corporations, donors in kind. The one key thing that, that I'm not sure is conveyed that's really important is similar to how, no family resource center looks like any other family resource center, their funding, also similarly doesn't look like any other family resource centers. Their family resource centers often are very creative in braiding funding from multiple sources in order to be able to exist. That's kind of the reality right now with family resource centers, but very thankful for all of you for being here today and helping them be more on the radar. And excited to thinking back to the state funding slides, like those weren't all there even just last year. So incredible to see word is getting out. Yeah, and somebody had flagged about family resource centers and a lot of staff being women. And, one thing to think about, as encourage you to take the standard certification training. And if you take the standard certification training and thinking about how you're staffing a family resource center and wanting it to be reflective of your community. And so making sure it's reflective both with gender and, with generations and different ethnicities and all of those different layers of diversity. So yeah. So it is something to pay attention to for sure. And the trainings do have a cost to them. There's a question about that. There is a cost to them. All of our webinars are free, and excited to get the information out there. And there is a cost to those. Let's see, what other questions do we have here? Let's see. And there's a question about, do you have to be a member to receive assistance? And if you could just clarify, receiving assistance for what? Maybe you just type in another question. That would be helpful just to make sure I'm understanding what you're meaning there. Sorry about that. So let's see here. Somebody had wanting to offer, I believe, if I'm understanding your question correctly, somebody's wanting to offer trainings and don't have the resources to pay for it. How can you offer funding? So if you're wanting to bring like this, if you're referencing like wanting to bring the standards training or the parent advisory training to you, to your states, one way that some areas do that is by working with local funders or by applying for different grants to be able to do that. That is one way that we've seen different organizations leverage local funding. If I'm answering your question correctly, feel free to clarify in the Q&A section if I am not answering your question correctly. Let's see. All right. Yes. Okay. I think we've got all of the questions answered. All right. And if we'll stay online here for just I know I asked a couple clarifying questions. So if I did not understand the questions correctly, just feel free to clarify for me in the Q&A section. We just want to make sure we have everybody having their questions answered if possible. And we have our names and our emails here. If you do have any additional questions after today, we invite you to reach out to us. We would love to connect with you. Thank you so much for your participation today. And we see a message that you'll follow up. Thank you so much. We appreciate the opportunity to connect with you. And I see Cheryl just dropped the link to the handouts in the chat. And all right, let's see here. So thank you all again so much for joining us for today's webinar. As a reminder, a brief evaluation will appear on your screen when you exit the webinar today. We really appreciate your feedback on this evaluation, as it very much helps inform future webinars. And thanks again so much for being here, for your engaged participation, for all of your questions, and we hope you all have a lovely rest of your Wednesday and a great rest of your week. Thanks again for being here. Bye-bye.